Welcome to Pharmacy View Podcast, where we provide regular interviews with pharmacists and key people within Australian pharmacy and the associated global industry. In this stream of podcast episodes titled RX to Riches, we delve into the evolving global pharmacy landscape, exploring the challenges and opportunities, and examining the current state of retail pharmacy across the globe. With each guest, we discuss the hurdles they face and the potential growth areas that may shape a brighter future for your pharmacy or industry-related business. I'm your host, Michael Alexander, pharmacist, digital health enthusiast, and co-founder of Audirie, an AI-powered communication intelligence platform serving the healthcare industry across the globe. My guest today is proudly brought to you by Shopfront Solutions for all your shelf and digital marketing needs, part of the Arion Technologies Group. Please note that the views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any company or organization.
To me, there's always more ideas, and there's not enough time to get them done, nor enough effort. I think MedSavvy was certainly brilliant, but as are you, Sean. But they're just as a counter to that in a way, like I think there's, if you find yourself facing those situations and you have lost some IP or some placement, I think there's always an opportunity to solve a problem in a new and different way. And there are ways that you can get back out there. So perhaps that is a little optimism on my side, but I've certainly had that happen before where I've lost ideas of my own, and it makes me feel better knowing, that was the only idea that maybe they could have, but I've got so many more. I can build something else.
Welcome to the RX to Riches podcast. My guests today are Nicole Cathcart and Sean Karbowicz, co-founders of the digital medication support solution, MedSavvy. Well, Nicole, I want to ask you before you jump in, because you're on the other side of the table, right? You have to tell Sean, hey, yeah, nice idea, but maybe we can go this way, instead. So, that's your job, right? To kind of put him on the right track, or a track he may not want to go down. So tell me about, did that happen? Maybe it didn't happen. Maybe you guys are always kind of really aligned. But did it happen, and how you phrase that and how you kind of work together? It's always hard to tell a founder, maybe you should try something different.
I don't think it was ever put as nicely as nice idea, but we should try something different. I think we created an environment where I hope I felt, and I think Sean did too. I mean, we all felt comfortable sharing what we thought was best, and we were all comfortable fighting for what we thought was best. And we would have constant design sessions. We'd have 2-hour sessions where we'd have a topic and we would just beat it to death. And, sometimes we didn't walk out really feeling good about things, and we opened, more Pandora's boxes than we solved or whatever. But there were definitely moments where we hit on some amazing things through that process of really questioning everything. We didn't know any better than Sean. We had some methodologies that we wanted to test the idea against in order to make it, better and better, right? So in general, as someone who's coached a lot of entrepreneurs, there is very rarely is that, no, nice idea, but no, we're doing something else. It's more, okay, that's what you're thinking now. What about all these things? How do you answer these questions, right? It's about getting everyone in the room to think differently about the problem. And yeah, maybe you're trying to guide people towards what you think is the solution, but at the same time, you have to always keep your mind open to, maybe someone else is going to say something. I think I know the best, but like Sean said, someone says something and I'm like, oh, that is the better idea. So let's pull that. So you have to be open to that process. It's very much the whole like improv, like yes, and like, yes, that's fine. That's great, but let's do better. Let's keep adding and refining probably more appropriately till we get to what the true thing is that answers the problem that we're really trying to solve.
I like that analogy, more improv, maybe jazz. It's a little bit of jazz, improvisation. But I think one thing we kind of skipped over is, we kind of talked about the initial idea, talked a little bit about how successful MedSavvy became, but obviously it's not all puppies and rainbows, right? There is a lot of obstacles and challenges about, in creating a solution like this. So Nicole, I'll start with you. Not only MedSavvy, but obviously, you've launched multiple different platform solutions and coached other entrepreneurs. What were the key challenges here, or just in general, that you see from getting from just ideation to, yeah, we've got something and we're getting some product market fit here?
Well, I think one consistent theme is like there's no such thing as like overnight success. Everything takes way longer than you think it's going to take. You think you've hit something, and maybe you have had a breakthrough, but it's not it yet. It takes a tremendous amount of persistence and perseverance to be an entrepreneur or an entrepreneur, right? You feel like giving up a lot. You feel like it's not going to work. And then you remember, why you're in the first place, and what you're passionate about, and who you're solving problems for. And then the next day you try again. You get shot down. I mean, rejection is normal, right? Whether that's funding or sales or even users, right? I mean, you just will never win everything. You will always lose some of it, and you just have to get used to that and be like, no, that wasn't the right person, or that it wasn't the right time, and you have to keep going. I think probably for entrepreneurship and building something like MedSavvy, one of the things that was the most challenging was the amount of control you really do relinquish to what that vision is, right? I mean, we had huge vision for what that could be, but it wasn't right for the company at the time, right? And other people certainly get to make those decisions. And it's not like we could be like, oh, we're going to go find another funder then that wants to do this differently. That was going to be the trajectory. And we could fight and fight and fight. And I know Sean did a whole lot more of that than I ever did ultimately. But, even early in its life, there was a lot of that, right? Trying to fight for the soul of what it was supposed to be and what it could be and the potential that it had. Yeah, so that part was certainly a challenge. I had the luxury of not having as much of a challenge of trying to do my day job as well as do this. I mean, I certainly had other things to do, but the more successful we got, the more I was allowed to spend time on it. So I don't know if Sean faced that, but that's certainly a big challenge for people that are doing side of the desk, and for entrepreneurs who are trying to build a company while you have a full-time job. It's always that conflict between the things that pay the bills and what you really want to do, or what you see as being transformative personally and to the world. So that's perhaps a little bit more about the internal journey of the entrepreneur, but I certainly have felt that. I imagine that Sean has as well.
Yeah, and then from some of the external challenges too. I've had conversations with many entrepreneurs since the MedSavvy days, since even when I was there, and then obviously after as well. And some lessons you kind of have to learn on your own is what I've come to understand. Because to Nicole's point, you might have an idea, and the entrepreneur is driving through all the roadblocks. You're rejected routinely. You know that there's obstacles you have to overcome, and there's naysayers, and you have to push through those. And then there's the harsh realities of certain circumstances that there's some boulders that you're not going to be able to break. You might have to go around them. And it's been interesting kind of talking to certain entrepreneurs about their view of the healthcare system, or reimbursement and kind of how things work, and data infrastructure and privacy rules. And people sometimes overestimate, or they underestimate the challenges. They sort of overestimate their confidence and their ability to get through some of those things. And I just have to smile and say, well, that's cute. Good luck.
You need a healthy amount of
you
need a healthy amount of confidence going into these situations. We're lucky we had someone on our team, Max Janisic, who is exceptionally good at getting around and doing everything above board, but was very creative about overcoming obstacles. Yes. And that was very, very useful through these processes to have people that were willing to continue on those fights, because data connectivity. There are so many things that are really challenging to do in healthcare, and the more you're in it, the more jaded you get. So you need that, somewhere in between. Don't be naive about it, but also you gotta try. You gotta try new things and try new partnerships and think of different ways to do things.
Well, on that note, actually, Sean, you said something very interesting in our pre-meeting, a turn of phrase, which I want to kind of explore a little bit further, which is the risk of going all in. And I think this really kind of dovetails nicely with what we're talking about. So talk to me about the risk of going all in.
So there's some practical aspects of going all in, and whether it's an idea that you're trying to be an intrapreneur or an entrepreneur for your own idea, outside of a large company, you own it. There's just, I'd maybe put these into a couple different buckets. One is just the human element of who are you as a person? And if you so closely associate yourself with your career, your job, that's just one facet of who you are as a person. And I think for me, I probably overshot that a little bit at certain points in my career. And, when I'd meet people, I'm like, hi, I'm Sean the pharmacist, and no, I'm more than that. I'm a dad. I'm a husband. I've got friends. I have a son and a sibling. And so I think that's just, a personal aspect that we just have to be careful of with any career and going all in, because the reality is, these are businesses. And unless you're, doing this for fun, most of us are doing this for money. And we kind of have to have a balance of like, how much of myself do I give? Now, that being said, what was phenomenal was to be able to leverage a lot of my prior experience and a lot of my capabilities up to that point and bring it into MedSavvy. So that was just super fulfilling and validating of the work that we had been doing as a team at the health plan. My other colleagues and I, very, very validated, and then also personally. I think there's also some pragmatic aspects to consider too, which is if you're an employee of a company, the time you use, the devices and the equipment you use kind of helps determine who owns that time. They're paying you for your time and your ideas and your brain power. So, if it's something that I think others should be mindful of. And if you kind of sign everything over to that company and they go a different direction, well, then, that's what you signed up for. Now, in retrospect, I think for me, it was a wonderful opportunity. I wouldn't trade it for the world. I'm glad I did it. And I'm glad we have had the impact we did, but there's some elements of that control and direction. I believe there's more work that could be done. There's more impact we can have. And that is a regret of mine, is that I didn't position myself or others in such a way to be able to deliver that impact that I think is still possible. So I do think that that's a concern that people need to think about. Who are you trusting, and what are you trusting them with? And it's a balance.
I guess in some ways I come at it from a different perspective, just having worked in innovation for so long, kind of trafficking in ideas. To me, there's always more ideas, and there's not enough time to get them done, nor enough effort. I think MedSavvy was certainly brilliant, but as are you, Sean. But they're just as a counter to that, in a way, like I think there's if you find yourself facing those situations and you have lost some IP or some placement, I think there's always an opportunity to solve a problem in a new and different way. And there are ways that you can, you can get back out there. So perhaps that is a little optimism on my side, but I've certainly had that happen before where I've lost ideas of my own, and it makes me feel better knowing, what, that was the only idea that maybe they could have, but I've got so many more. I can build something else.
I totally agree, Nicole. I think in the moment, I was kind of in despair of like, wait a minute, where's this going? This isn't where I wanted to go. I'm not going to be able to do the thing that I wanted to do. But to your point, in retrospect, I think that's one of the things that, now kind of stepping away for a couple of years, I have the confidence that, I've got plenty of ideas, and there's many more that I'm able to develop and work on. And it's just a word of caution of if you can avoid a pothole, don't step in it, or don't drive in it if possible. So just be mindful of it. And again, I think, but that idea of a person going all in of themselves and having such high hopes and kind of clinging to or trusting that, you're the company or the other, and I've talked to multiple people in various industries who have had a financial partner back out at them at the wrong moment, make a poor decision. Maybe someone made a decision that had nothing to do with the business, but they made a poor personal decision that ruined your chances of success. So the risk is often worth taking. It's just important, I think, to have that mindfulness of how much of me is wrapped up in this. And if things go sideways, how much of my heart is going to be impacted by this, and just make sure that you can live with that.
Yeah, absolutely.
Yeah, I think it's just a matter of not defining yourself on whatever happens with your company, which is very hard to do when you're an entrepreneur and you are the company for many years and it becomes your baby. So, but you do need to step away and say, well, I'm more than just this thing that I've created. I'm a husband, I'm a father, I'm a mother, I'm a daughter, whatever it is, which is easier said than done, I guess, in many respects. So, and just so our listeners are clear, MedSavvy, what ultimately happened, it achieved a lot of success very quickly, but ultimately was absorbed into, I suppose you'd say, the wider sort of tech stack of Cambia. And so the spirit, the functionality still lives, but not as a distinct entity anymore. So I think that was sort of the conclusion. And Sean, you mentioned, felt a little bit of despair about that, even though it did live on, but in a different form. But obviously, I guess I asked the question, and I'll ask for both of you. Sean, you first. What would you have done differently, if anything, now that you have time to look back on it?
Yeah, it's a great question, and it's definitely something I've grappled with, because on one hand, if we did more of the same, would we end up in the same spot? I can't pinpoint one specific thing that I would do differently, but I would say if it's a real challenging question, Mike. Actually, I don't know. We might want to I might want to do over with that answer.
That is such a hard question, because I think, Sean, if you and I were to do this now, it would be a totally different product. You know what I mean? Like, the experience of having gone through it certainly changed me as a person. It's changed my skill set, so many different things going through that. So it's hard to say that I regret something in the macro. I mean, there are plenty of small moments that I regret, but nothing really big, because I think our hearts were always in the right place for what this was. It was never about us being like professionally successful. It was like, we're going to build this awesome thing and it's going to help people. It's going to change things. Like, that's the perspective we had. And I think as long as we had that and we did what we could to the top of our abilities at the time, then like what could we have done differently, really?
Yeah, it is a really difficult question to answer. And I think looking back in retrospect, there's some of the coulda, woulda, shouldas, but it's probably a question that's better not answered. And it's maybe a better question to think about, okay, knowing what I know, learning what I've learned, what can I do now? Because time does change, circumstances do change. And I definitely think that if I were to try to solve that same problem now, I would approach it differently. Simply because there's new learnings, there's new technology, there's new capabilities, how we build things, and how people interact with technology is different. The market of pharmacists, if you will, the healthcare ecosystem has changed. So, it's a difficult question to say, how would I go back and do things differently? I wouldn't change the experience, but certainly going forward, if I were to start today, things would be different. Absolutely.
Absolutely. And I look, a lot of entrepreneurs would be thrilled with the success that you both had with MedSavvy. So, it's one thing, to put into context. Of course, you'd want things to maybe turn out a little bit differently or go a different direction. But the success you had, I think, was tremendous within a very kind of challenging environment for innovation. Let's face it. When you're dealing with innovating within large companies. But I agree. Let's look to the future, a little bit more hopeful bend, and maybe talk about other gaps you see, whether it's in pharmacy care or healthcare in general, that can be filled with digital solutions like MedSavvy. So, Sean, I'll start with you. You kind of started talking about, well, if I was doing it now, obviously there's new technologies and things are different. So have you kind of thought about different gaps, different areas that you might want to, maybe try your hand in the future?
I mean, there's this idea, there's an idea of personalization, and that's what we all talk about in healthcare, is personalized healthcare. But the reality is, when that's the goal, but what tends to come out of it is very similar impersonal care, because we have a technology that has now replaced what maybe should be an interaction of a person who can actually help navigate someone's care. So again, I don't want to be negative here, but but that is a risk. When we start to rely on technology, people assume that the technology is going to replace the person, and I would strongly advise against that. And I'm looking at how can we personalize care thoughtfully, and maybe scale, again, kind of sort of scale pharmacists and healthcare workers. So thinking about using technology as more of an extension for ourselves, not for things like that are added on, like administration, checking boxes, and people who work in healthcare understand what I'm saying when I talk about administrative burden of getting things done. And that seems to be what technology tends to do in many cases. I think there's an opportunity to be disruptive in terms of scaling the impact that a clinician has. And the way to do that is through personalization. Almost, make me more accessible as a pharmacist, frankly. Right? Like, how can I work more closely with an individual patient and have the technology behind me and support me so that I look smarter, I'm more responsive, et cetera, but I'm still, as the pharmacist, front and center. I think the opposite of what tends to happen is the technology is between me and the patient, and that isn't necessarily beneficial or personalization.
Yeah, Nicole, I'd love to get your viewpoint as well about some of the key trends and technologies in the digital health space that you feel will have a major impact in the coming years. Personalization, obviously, a huge area, trying to solve the interoperability problem and sharing data. Those are kind of some of the big rock items. But I'm just curious, from your vantage point and having your hand in a lot of different types of sectors and healthcare activities, what do you feel are the biggest the trends in the coming years?
Well, I don't think we could have this conversation without mentioning AI a couple times, right? I think, just building off of what Sean said, I think that concept of human, like remembering what the human interactions need to be like is even more important as we're trying to add AI to everything. And there's so much potential for bad information being out there, and for those those artificial conversations being falling very short of the empathy and the meaning that happens in human interactions. I think that's an area I'm very interested in. I mean, AI spans so many different sectors within healthcare, or segments of healthcare. But I think if we can do more of what MedSavvy was trying to do, and what so many solutions are trying to do, which is make meaning out of data. Healthcare is so obtuse sometimes, intentionally, right? So AI has the potential to add a lot of transparency and ease user experience in those areas. And whether that's internally, like I think, Sean, that's some of what you're talking about, is like, how do we take some of that burden of process and administration away from people that are actually delivering care, right? So same thing, I'm interested on the consumer side, like how do you use it to materially change how consumers are interacting with the healthcare system, how they are empowering themselves with the right information at the right time. I'm personally very interested in the caregiving and age tech sector. I think that's an area that's just going to blow up incredibly, especially in the next less than 10 years. Areas that I think there's a ton of additional investment and technology that's needed to change what those experiences look like for people, right? So yeah, I mean, the more consumer, my short answer on interoperability as a non-technical person is, the more consumers are actually engaged in healthcare, the more they demand the solutions, because they're not really demanding them yet. This is not what demand looks like. But the more that they can't function without access to their data and the right information, the more power we give them, the easier interoperability is going to be, right? The systems are going to follow the people. And maybe the people have to affect government and laws first, but it's going to start with the people, because then too many entities are fine with the way things are now.
Yeah, and I really, really like what you said about using AI really to almost supercharge providers and extend their reach, rather than trying to replace the very important role that providers have in communicating to patients with, chatbots or things like that, which, personally, I can't stand when, I see those sort of AI chatbots trying to give medical or wellness advice. There's a level, I guess, but it has to always, be in service of the provider-patient relationship and really cater to the patients. And I think there's a huge opportunity in my mind, being I guess an ex-pharmacist, I'm still a pharmacist, but that to think outside the sort of four walls of retail space. How do I extend my reach, to really meet those patients where they are, while leveraging AI and the new technology? Sean, would you agree?
Absolutely, and I think we have to acknowledge what we've learned over the past few years, and in healthcare with COVID. It's hard not to talk about COVID, just like it's hard not to talk about AI, and it's hard not to talk about health equity when we talk about healthcare and health delivery. And one of the things that MedSavvy, in our MedSavvy experience, we tried to design MedSavvy to be used by everyone and anyone. And it's a challenge to do that in healthcare, because people are so different and they have such different preferences and where they are and things like that. So is there a way that we could meet more people, sort of acknowledging the differences and their, not just preferences, but also their cultural view of the world, their socioeconomic view of the world, their values? And so when we think about personalization, sometimes it's not just health personalization of these are my diseases and who I am, but also who am I as a person, and how can we, again, meet people where they are. any, whether it's people in rural areas or people in urban areas, or people who are new to our very confusing healthcare system, and coming to the country and not speaking English as their first language. Those are all circumstances where maybe technology can help us fill a gap, and I think the word you use, supercharge, the health provider, and I think we need to look at that really carefully. Oftentimes what I find is when we get into these circles of digital innovation, it's people designing for ourselves and people we went to college with, and that's who we have in mind, and that's not always the healthcare consumer that we need to be solving for.
I think, or I hope that what you're saying, and the truth, the idea of all these different segments and people really appreciating health equity more than they have in the past really opens up the field of what is possible to build, right? Think like you said, okay, here's a lesson learned from MedSavvy, and we should have designed it for a more specific audience, right? Because we could have, maybe that would have been, a magnet for them to explode beyond what happened. This is pretty standard startup advice, right? You start with a really engaged, small, narrow market. And maybe, people really internalizing health equity and understanding that these are real meaningful differences between populations that can impact health if they're appreciated and designed for, will result in, different people designing solutions, right? Maybe they design them for their families, but they don't look like our families. They look like different families, and that is all good. It's only, that only raises all boats, right? We have new and interesting ideas, and those can grow together and merge together, and the whole industry can change.
Well, on that note of lessons learned, my last question to you both: what advice would you offer both individual entrepreneurs or maybe even organizations that are looking to innovate in the digital health field, whether pharmacy or some other solution? What advice would you give somebody or some buddies if they're looking to start this journey? And Nicole, I'll start with you, and then I'll end with Sean.
Ooh, there's so many different things. Stay curious. That's a really good place to start. Be patient. Be open-minded, right? You're, to some degree, you're trying to paddle the boat where you want, and sometimes you just have to kind of go with the current. It is a journey. I think I just want to say I think it's very funny to me that Sean introduced himself at the beginning as a skeptic, because I think what he meant to say was a scientist, because I think that is the mentality, and that does work really well with innovation. So, maybe another part of this is, looking for the unexpected innovators within your organization, right? There's no profile for what that person looks like. Everyone can be that person with these things, with curiosity and persistence, right? You find people that can help you along the way, and you take their advice and you just keep going.
I think it's hard to I agree with everything Nicole said. I think it's hard to argue with someone who's focused on a customer and is really keeping the problem that the customer has front and center. And regardless of the environment you're in, whether it's an entrepreneurship or an entrepreneurship, if you're seeking funding, if you really understand the problem that you're trying to solve, and it's not your problem, it's someone else's problem, you're bringing a solution. I think as long as you have a really thorough understanding of that problem and how your solution is going to solve it better than any other, it's really hard to argue against that. And that to me is really powerful. And in any environment, whether you're an entrepreneur or even just in your regular day job, improving for the customer, improving for the patient.
Yeah, and I think really, as I reflecting back on our conversation about the story of MedSavvy, to me, it's a story not so much of a triumph of hope over skepticism, but more of a study in maybe hopeful skepticism. I don't know if maybe there's a better way to turn a phrase, but that's kind of what occurred to me as you both were talking. But I just want to say congrats on all your success. I can't wait to see what you both do next in this field. So Nicole and Sean, we'll leave it at that. Thank you so much for your time today.
Thank you.
Thank you for having us.
Thanks for joining us today on the Pharmacy View podcast. And don't forget to like, share, and leave a comment if you found this episode of value or have any feedback. Podcast episodes are promoted through social media, LinkedIn, YouTube, and major podcast mediums. And each episode can be found on the Pharmacy View webpage with links to guest contact and business details. If you're a pharmacist or industry support supplier and would like to join us on an episode, send us a message through LinkedIn or complete the inquiry form on the Pharmacy View webpage. I'm your host, Michael Alexander, pharmacist and co-founder of the communication intelligence platform Audirie. On behalf of Shopfront Solutions and Arion Technologies, thanks again for joining us today on the Pharmacy View podcast.